This is part two and second most important factor for our heart health. This is Dr. S.M. Goel, MD Medicine and DM Medicine. I'm in US for last 30 years. I'm from a family of doctors, husband and wife from All India Institute of Medical Sciences and Delhi University. And I mean the focus of this video is heart. And all top medical bodies have said, cardiologists in US, there are nine most important factors in order of importance. And I did talk about the first factor in video is there. Today I'm going to talk about the second factor. You may talk about genetics, but genetics is only 10%. All these studies have proved only 10% role in our heart condition. 90% factors are modifiable. If we knows those nine factors and we are aware of them and do our best to deal with it, we can really have a very healthy heart. And this focus is on heart and including all our health. Well, heart is one thing we all worry about. We can lose our life in 5 minutes. Uh, so the second factor is smoking. I've written a book on it, and I believe is it either published or I will gonna publish it very soon. As soon as I mention about all the nine factors, every day I will dictate a video or do a video for one factor. So smoking, there is no question. The whole world and all the countries in the world now, in US, in India, dramatic effort by the governments to reduce the smoking. Why? Smoking is the leading cause of cardiac death, sudden heart attack. Absolutely. It's unbelievable how important smoking is causing, heart attack. But what is dramatic is Indian government is trying very hard. You have seen those all the advertisement before you go and watch every movie, and those are horrible. After that, even put one cigarette in the mouth feels, oh my God, no, no. Um, but uh, but all the research is showing, if anything, smoking in India has gone up by 7%, while in US it has come down 7%. And when you talk about 1,300 million people, 130 crore people in India, and 7% has gone up, and most of the population is younger generation in India. And in US, there are about 400 million people or 40 crore people, and actually smoking has gone down by 7%. So you have to do everything to cut down and quit smoking. It can be done. You will, first thing, please do not hesitate, do not be shy in talking to your doctors about this smoking. All the researchers also shown, none of the doctors, whenever you go to a doctor, no doctor tells you to quit smoking. I am telling you, this is unbelievable. In US, every patient who walks in our clinic, we had to talk about smoking and drinking. We have to document it. We have write down, and we screen for everything else. And if anything is wrong with your health, it's not your fault. It's our fault. Our doctor's fault in US. We are responsible. Insurance gonna hang us. Why you not taking good care of your patients? And which also means that if we are not, then they will end up spending thousands of dollars, because they have to pay for everything in US. Insurance is very costly. Medical insurance, health insurance, very very costly. Some we have end up paying like 4 lakhs rupees every month. It's so costly, but then it pays for everything. Um, so what I'm trying to tell you that also, so you have to do everything to cut down smoking. You have to keep fighting rest of your life. You can't quit. You can't quit. um what is another important fact is that if you quit smoking in 2 years, for 2 years, your risk for dramatically goes down for the heart attack, and it is the number one cause for lung cancer. And lung cancer is not easy to diagnose, but I will tell you what we need to do about the lung cancer, how to diagnose lung cancer in separate videos. But what does smoking do? It cuts, it does tons of things. It most important is most important is the heart attack. Let me continue.